our role will be mainly in the area and to heal what we call, what Dr. Romualdez called fragmentation in health services. We have expertise in linking in a given geopolitical region all the available health services into a network. And in the process, maybe we will also like to double a little bit on how to finance them. That's our ambition in the group, to identify sources, how a system like this, an integrated system, let's say, in Health Region 1, incorporating all the primary, secondary, tertiary hospitals together in a network, and how are we going to support them financially so that they will deliver the necessary care. That's, I think, where UP can come in developing this kind of model. Now, in relation to the other medical school, I'm afraid that we have very little influence of them right now. And that can be traced to the policy that literally left the school problem in the marketplace. Anybody who wants to establish a medical school, provided they have the resources, can do so. This is not the case in many advanced countries, where not only the emergence of new schools, but also the number of students produced, the number of specialists produced are determined on a yearly basis depending on need and resources. Let me give you more important, a good example, because this is close to heart, we know, we're very familiar with. In the United States, the number of specialists in medicine are determined on a yearly basis. And from this, all training hospitals will follow. If I tell at the hospital, you're only good for 2 cardiologists, you cannot get 3, you cannot get 4. This is the way they try to exert this influence. And this goes down up to the level of what we call quality of education being given. So I hope Professor Abueva may want to comment on that.
Yes, later. Thank you, UP Diliman, for your question. We now have UP Tacloban. Our moderator there is Professor Irene Tan. UP Tacloban, please come in.
Good afternoon, Dr. Domingo. We appreciate your bias for the community, your love for country. May I know what happened to the Doctor to the Barrios program?
There are 2 health secretaries here. I know the answer, but that is be impolite of me.
Perhaps
Dr. Romualdez,
former Secretary Romualdez, who was Secretary of Health approximately about nearly the time that the Doctors to the Barrios program was implemented. Dr. Romualdez, please.
Yes, thank you. Yes, the Doctor to the Barrios program is still going on, no? Because every year there continue to be vacancies. What the Doctor to the Barrios originally was conceived to fill vacant municipal health officer posts. And every year there are approximately between, I think now it's 40 this year. But we started, when it was started during the time of Dr. Flavier, there were over 100 municipalities that needed doctors. I think it will be continued because there is always a growing need for manpower, and maybe this can be replicated in other health professions as well.
Okay, thank you, Secretary Romualdez. We have time for a couple of more questions. We have a request from a Dean of the College of Nursing, who is present here, Dean Josefina Tuason, to give a reaction.
Good afternoon, Dr. Domingo.
Yeah,
I'm almost sure, sir, you dropped a bombshell earlier, and I'm almost sure half of the audience who knew I was at the back would expect me to say a comment.
Yeah.
The number 72 of the 100,000, I'd like to bear that out a bit, because I would also like to declare that we are nonstop getting pressure and comments that we should increase our enrollment at nursing. Events today bear out the correctness of the direction that we have taken at the College of Nursing not to increase our enrollment. Today, we see unemployment, we see compromised nursing education, and I am happy to say to the crowd, to the UP constituents, to everyone who are listening, that we are proud to say we are able to maintain the same quality of nurses that we have produced all through these years. The impact of a college and nursing is not in the number, but in the quality and the impact of its graduates. Sir, maybe to just deepen the impact of UP Manila, I would really input that nursing has had a lot of the inputs of UP Manila in achieving its missions. The College of Nursing is not lacking of people who have stayed in the country. We have Minda Luz Quesada, who you know has achieved a lot, to name a few. We have been recognized as a collaborating center in primary health care, and therefore, to reduce the impact of the college based on number is something that deeply concerns us. Today, we are working very hard, and we hope that it will be recognized that at the heart of what we do is actually servicing the health of the nation. That's all. Thank you.
Thank you, Dean Tuason. We just one more question,
Can I
please.
just
It has to
reply?
be a question instead of a reaction.
Mr. Moderator, just rejoin there. In fact, Ping and I are on the same, we agree on the basic things. I never said that the response to this is to increase enrollment. I am against enrollment because simple mathematics will tell you, supposing you triple the enrollment, will that even budge the problem in nursing? No. What we need to do is produce a new kind of nurse. If you have 72 graduates, if a new hospital opens, they can get all the 72 nurses. If they are all doing is nursing care, giving pills, giving blood pressure, etc., what impact will that have in the nursing program in this country? On the other hand, if you have nurse epidemiologists, nurse pharmacologist, nurse manager, nurse teacher, so many oncologists, we have no nurse oncologists, and yet we have many cancer patients who can be taken care of by nurses, not by doctors. Chronic diseases, rehabilitation. This calls for a different kind of nurse, not the traditional nurse who will have an 8 to 5 work in the hospital being brutalized by the doctors. What is our payback there for the kind of education we give them? No, we should get out of this. Don't increase the number, maintain the number, but produce a different kind of nurse. A leader nurse, an innovator nurse.
Yes,
Thank you.
One last question. I recognize Dr. Delen de la Paz, as long as it is a question and not a reaction.
Okay. Good afternoon. I'm Dr. Delen de la Paz from the College of Medicine. My question is, given the situation where we don't fall in a vacuum, so a lot of the issues that Dr. Domingo have raised are really laudable and would really redound to improvement of the health system. But my question is, to what extent can UP Manila really influence the improvement of the health system that is very much governed by the economic policies of government, such that the budget is so small, it's just 1% of the national budget, that you can't even move within that system in improving the system. And the nurses and our doctors are leaving the country, not because they want to leave, but because the system itself cannot support the needs of our health personnel and provide for the needs of our people, so that we will also have a sense of fulfillment that we are doing our job. So I think UP Manila, to what extent can UP Manila really be a strong voice in influencing these policies of government?
Thank you for that question.
I agree with
Domingo.
you. I agree 100% that why I focus health reforms. We agree that health reforms cannot exist in a vacuum. there must be a corresponding health reform in other sectors, politics, etc., etc. In fact, when preparing for this lecture, I was tempted that the ending will be a quotation from Jesus Laba, because Jesus Laba said, when it's 1938 class, when I practiced in Pampanga, I found out that none of my patients survived. They are too poor to buy medicine, etc. And therefore, I realized that what I'm doing is futile. I must reform society first. That's why I have to go underground.
Jesus Lava was a physician.
He was a physician, class 1938. But the government, who should have listened to him, did the opposite. They hunted him as if he were a common criminal. You are right. While we talk about medical reforms, this cannot prosper without reforms in other sectors. Unfortunately, we are not, influential there. But we will do our best, one step at a time.
Thank you, Dr. Domingo. Let me now wrap up the open forum to mention that indeed health is something that is palpably felt, not only here in the campus of UP Manila, but in all the constituent campuses and universities of the Philippines as well, as judged by the quality and intensity of the questions raised. And definitely, many of the issues raised by Dr. Domingo in his centennial lecture has implications in terms of the selection of students and faculty and policies that will resonate all throughout the university in all our constituent campuses nationwide. Thank you, Dr. Domingo. And may I now request the Honorable UP Regent, Dr. Nelia Gonzalez, to give the certificate of award to Dr. Domingo.
Before I do my job of giving this certificate to our very good centennial fellow, let me just give two statements. First is, on the floor, somebody asked, what will it take to get our students or our doctors or our nurses on ground and not allow them to go out? My answer is very simple. You don't ask them through a bill or some sort. Give them a chance, like we did for my granddaughter, who is a doctor and a graduate of the College of Medicine. Not Dr. Arcadio or Dr. Alfiler can help me ask her to stay put because there's a big job there. It is when she stayed there for 2 years, and when she came in, I was so happy because when she went into the State University of New York, all she did was present her biodata. And when she was being interviewed, she said, where did you graduate? She said, University of the Philippines. Okay, you're taken in because that is your best